Baby, it's cold outside, but you can warm up someone's day just by sharing a smile. And now there are new ways to upgrade your grin and make it last longer. Dentist Steve Marsh is here with the dental details. Welcome back to the show.
Thanks so much, Lori.
Now, we thought nothing lasts forever, but you have a material that comes close to it, right?
So one of the biggest changes in dentistry over the past few years is a material called zirconium. And zirconium is a type of porcelain, but it's 4 times stronger than any porcelain we used to use. So I actually have an example of it. I'm going to hold it up here. And this is actually a crown on a digital model. And today we use a 3D printer to print these models. So we take a digital impression, 3D printer prints this model, and that's actually a crown that's going to go in someone's mouth, a woman this week, and the crown is sometimes done digitally, sometimes by hand, but it is made of zirconium. Zirconium is very, very strong, and it's excellent, especially in back teeth and some other areas.
Okay, so that must be where mostly it's used then, on those molars that really have to crunch the food.
Well, great question. So we've always used it in the molars. That's where it was really developed for, because when you close down, it's almost like a nutcracker. We're past the Christmas season, but nutcrackers have most of the pressure back in here. And so it was very good for back teeth. The color wasn't as good as normal porcelains. Well, today, the colors, the vibrancy is almost equal today to old porcelains. So we can use it in the back. We can use it for bridges when there's spaces. We can even use it in the front in some cases. Again, it's something you can be it works very well.
Okay, you probably have some pictures here to show us.
I thought that would be the best way. So let's talk about wear. And this is what we see as a dentist, the before picture looking into a patient of mine's mouth. Very active in the community. He ground his teeth at night. He had a problem sleeping as well. And the only way to restore his mouth to a normal size was to use porcelain. Well, I've just mentioned these materials. In the back molars, we use this zirconium because we knew it would hold up very well. And in the anterior front segment, that's a different type of porcelain. If you look closely, Lori, it's hard to tell the difference, and you shouldn't be able to tell the difference.
Yeah, I would not be able to know, no.
So again, this is a combination of porcelain, zirconium in the back for strength, and some of the older porcelains that we use in the front that still have beauty, still strong, but not quite as strong as zirconium. Here's another use. Patients of yours that have lost teeth, or not yours, but viewers, let's say, who've lost teeth, used to have a partial that went in, or sometimes a bridge. The bridges, Lori, were made of an acrylic on metal or a porcelain on metal, and sometimes you saw that metal showing after a period of time, or the porcelain would break off the metal. Today, this is an example of a 4-tooth anterior front bridge that we did to replace the missing tooth. That was the day the tooth was taken out. And you can see it looks beautiful. Again, no metal, porcelain, very strong. We think it'll last the rest of her life. She still has to take care of her teeth. And just as an aside, her lower front teeth were very uneven. We wanted to focus on the upper, so I did some reshaping, contouring very easily. But that's a wonderful use of porcelain. And zirconium. We talked about implants before. This is a patient, had 3 implants, her lower right. We use zirconium again. It's very strong. Sometimes we connect them together, sometimes individual. In this case, individual, so she could still keep it clean, floss between them. It really a wonderful answer to her problem. I think we have one more. And this is a really interesting case, and I'll try and go through it quickly. A young girl with her boyfriend, she fell down, broke off all her front teeth. They were not savable. They had to be taken out. Because of the fracture, she lost a lot of bone as well. This is a zirconium, all zirconium bridge. If you look closely on the before, you can see the pink porcelain. So we have zirconium, we have a pink porcelain. We placed it in her mouth. She was missing the 4. We used 2 teeth on either side. Not a candidate for implants again because of bone loss. So zirconium is not only beautiful now, but strong, even on a 24-year-old girl who wanted to restore her smile.
Yeah, hopefully that'll last her lifetime.
That's what we're hoping, yes.
You can have the coolest smile in town using the hottest in dental design. For help, give Steve a call. The number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.